guys, welcome to Culturally Prescribed. My name is Victoria.
My name's Ombeni.
And we're just gonna have a conversation.
Just talking.
Okay. Tell me about yourself.
So, my name is Ombeni. Mm-hmm. I'm from Nashville, Tennessee originally. Yeah. And I've been interested in pediatrics since I was like maybe 7, 8 years old. Mm-hmm. So for me, like, it was not, I mean, I'm also African. So it was either supposed to be a doctor or lawyer. And I chose the doctor route.
Well done, well done. So I definitely can relate to that. My family's originally from Haiti. So all Caribbeans in general, especially once they've immigrated to the U.S., really are looking for better opportunities for their kids. Yeah. You know, so we're always expected to do 1 or 2 steps above what our parents have done, no matter how accomplished our parents are. I will say that, like you said, at a young age, I was interested in medicine. I had my little doctor's kit when I was like 4 years old that my parents bought for me. So maybe they were pushing me in one direction.
Oh, you know what they were trying to do.
You know,
they were trying to push you that way.
Anyway, I don't know. But I still ended up going it. I loved it. So I'm actually now in my last year of pediatric residency. Thank you.
Yes.
At Vanderbilt Children's. And I literally have like 2 weeks of residency left. And I'm so excited.
That is awesome.
Yeah.
So I guess my question would then be, what are you going into? Are you going into hospitalist or specializing fellowship or anything like that?
Yes, thank you for asking. So I am going to do pediatric emergency medicine. Okay. So I think with pediatrics, obviously you can go straight into private practice, or you can kind of go down the urgent care route without doing any more training. Yeah. Or you can subspecialize in some of the things that you mentioned, pediatric hospital medicine, you know, peds GI and all these other things. For me, as much as primary care is needed, that certainly wasn't my path. I just needed something that was a little bit more fast-paced, would still give me a variety of ages. So, I mean, in the ED, we'll see anything from a newborn to 22 and sometimes pushing it depending on what subspecialty they're involved in. Okay. So, you know, we tend to think of pediatrics as being like up to 18 and they're an adult. Yay! Yeah. Not the case, especially for some of our like congenital cardiac diseases patients, or like even oncology patients or cancer patients. Sometimes we'll even see them up till like 26, 27. Yeah. So it's crazy because they may be right about the same age as you, but you're still taking care of them. So peds emergency really just afforded me the opportunity to be able to kind of have those things. I also like to work with my hands. So procedures are a definite thing that we get to do. I also like the various like range and acuity. So sometimes it's like a runny nose kid, or it can be like a trauma that rolls in. Yeah. We've seen gunshots. We've seen, you know, ATVs that have rolled over and, you know, kids have like a traumatic brain injury. We have seen such a variety of things. And I think it's so special that we're able to kind of help these families through what may be the most difficult time in their lives. You know, and even with some of the things where it's a runny nose, clearly the family was worried enough to bring their child in. So I think it's so such a privilege that we're able to be there in that moment.
I have a 1-year-old, or he's turning 1 next week. Okay. So we've definitely called Vanderbilt for a few things. Yeah. Breathing, rhinitis, all the jazz, because especially when they're, you know, 2 months, 3 months, you're just like, what's going on? And then he started daycare at 9 months old, and we're just like, okay, he's getting sick, and we're worried about COVID and all of that. So I'm glad that there are people like yourself who are willing to go through with working with the families, because it can be stressful.
And I think that's the thing about peds. You're not just dealing with the patients, you're dealing with the parents and the families, and some of that is what deters other people from going down that route. But I don't know, I like talking to families and kind of reassuring them and talking them through what to expect, next steps or things like that. Just to have them be a part of the team, because they are also important in making those decisions, but just giving them some peace of mind and hopefully offloading some of that stress so that they know that they're not alone. Yeah,
because I feel like a part of medicine is just the educational aspect of it, especially as doctors. And, you know, I've always viewed it as when I'm going to talk with a family, everybody needs to be involved. Yeah. So it's so important not only to have the education with the parents, but also with the kids, especially when they get to that age, as teenagers. You need to talk to them about what's going on, because I have asthma myself. So if I did not understand how to control and work with my own asthma, and it was just my parents, I could be in a whole bunch of different crazy situations. So
of course,
that's one of the reasons why like pediatrics has always been very interesting to me.
Yeah, and I think it's also fun because, you know, even the teaching for the patients, it doesn't start even when they're a teenager. Yeah. You can tailor adjust things to a kid that's 3, 4, 5 years old. One thing that I love about any children's hospital is that they always have child life specialists. Okay. So those are people that, you know, they may be on the floor, they may be in the ED, but they are so good at helping kind of little kids understand what's going on. Yeah. So it may be that they bring in a stuffed animal and the child is about to get an IV placed. And they, you know, will demonstrate on the stuffed animal. So then the kid's like, oh, that's what's happening. And they'll be like, oh, it may, if they're numbing the area, you may hear a pop, you may hear a this. But then suddenly the kid kind of understands, you know, what's going on or kind of what to expect. Gotcha. So I think it's, you know, just nice that we also have so many wonderful people from, you know, the child life specialists to pediatric nurses, people that have devoted themselves in a way that's so special to the population that we take care of.
Yeah, and that's so cool. I didn't even know that like people did that, because I thought it was always like the doctors who had to really do it. Yeah. And you know, some doctors don't really have the best
bedside
way, or a way to at least explain to kids. Because I mean, you want to help kids. That does not mean you know how to explain things to kids.
Exactly.
So no, that's pretty awesome. I'm interested in pediatric nephrology.
And, we need people like you that want to do that.
And I'm also interested in sickle cell research as well. So what kind of avenues have you seen open up at Vanderbilt when it comes to like being able to do research during residency?
Okay, so that is a fantastic question. So there's definitely opportunities to do like different kinds of research. So some people tackle more of like the QI, quality improvement type studies, where it's kind of like, I've identified the problem, I have proposed maybe a few different solutions or interventions, and let's see what happens from that. And then we can always pivot as we need to. So there are plenty of people that are interested in that in all different departments. There are some people that do a little bit more of like bench research. So there are definitely opportunities for that. I think within the pediatric nephrology department, I would say ours is a pretty decent size. You get to know each of the nephrologists because, you know, they rotate through on service. You may see them in clinic, and they are all actually fantastic people. All different personalities, but so fantastic. It's like to the point where we have all of their cell numbers. If I'm on a different service and I'm like, yo, I think I need a nephrologist. Literally, there are some that I can call without even like giving them like a page warning or anything. And I'm like, yo, Dr. Jabs, yo, Dr. Hunley, Dr. Vandervoort, I need your help. And they're completely fine. So they are definitely open. It's interesting because I think technically there is a fellowship program for peds nephrology at Vanderbilt, but really, I have never seen a fellow there, at least over my last 3 years. Nephrology is not one of the most common subspecialties in pediatrics for people to go into. So I think if that's really your passion, you would have a wide open lane in general, but definitely at Vanderbilt. And it's so funny because I think there is maybe one of the interns that's interested this year in nephrology. So one of the first year residents, and they all of the attendings are super excited. So you would have literally the full backing of the department if you ended up there. So I think no matter where you go, I think it's just important to set kind of like expectations or just kind of say, hey, this is what I'm interested in, and not to pigeonhole yourself, but also just to see kind of what opportunities they would be able to provide you with so that you can also think about your career advancement, but also kind of carving a niche out for yourself, especially if you're like, these are things that we're interested in. So I think you mentioned also sickle cell. Our sickle cell program at Vanderbilt is surprisingly thriving. I think that's one thing that we're exposed to a lot on the inpatient side. So on like whenever you're on your P-T-Monk rotation, you'll see plenty of oncology, so various pediatric cancers, but we also see a lot of sickle cell patients. And as you already know, they are predominantly Black or African American or whatnot. So it's Definitely interesting. There are some of the hematologists that have a special focus or interest in sickle cell. There's at least one that I can think of that really we direct almost all of our questions to.
I know who you're talking about. Dr. Michael DeBon.
So there's him, but there's also Dr. Volanakis.
Oh, I know Dr. Volanakis too.
So he's awesome. He's great. And it's funny because he's kind of a quiet guy, but like sickle cell is kind of his jam. And you'll get to see sickle cell patients both in the outpatient setting when they're outside of a crisis and then in the inpatient setting, which can get really interesting. I think there's not really any other service where you have the opportunity to kind of like titrate like opioids and like PCA pumps where they may get like a basal rate of kind of like an opioid, but they also get to be in control of their pain and have like a demand dose as well. You don't get that kind of exposure. Gotcha. So I think that, again, if that's an interest of yours, you'll be able to see a lot of that at Vanderbilt. And I'm sure at, any major children's hospital, honestly.
That's awesome. With you being a beautiful
Thank you. Oh my goodness.
Woman in medicine. What has your experience been like just going through Vanderbilt, but then also just being a Black person in medicine?
No, I think that's a great question. So I'm going to start at maybe a little bit before then. So I have lived in a lot of different places across the U.S., including in the South, but I actually did med school in California. Okay. So
what school, if you don't mind?
I went to Loma Linda University School of Medicine.
Yeah. I lived over there by Rancho Cucamonga.
So you know the region.
Yeah, I know the region.
There you go. So yeah, you know exactly what I'm talking about. Inland Empire area. And then I'm actually, and then I'm originally from New York. That's where I was born and kind of raised for at least like, the initial first decade of my life. So anyway, I feel like I've experienced kind of these little pockets of like subculture throughout the U.S. And the South is definitely different. Granted, I will preface this by saying I did high school in Tennessee. Okay. So it wasn't a complete culture shock coming to Nashville, but it was different. I think in some ways, Nashville's kind of cultural diversity surprised me, at least at Vanderbilt. So we, in terms of our patients that are represented, we have a large like East Asian population and languages that I've never heard of. Things like Karen or Karen and Zomi. Those are things that I never would have been exposed to anywhere else. Yeah. We also have a large Arabic Egyptian population, which was surprising to me, thinking that it was the South. And Kurds, right? So we have a lot, like just a variety of languages and cultural diversity and just kind of even religious backgrounds that I think are represented that surprised me. So that was important to me, going to a place where I'd be able to be exposed to all these different cultures. Even in-person interpreters, we have several Spanish interpreters as well as Arabic Egyptian interpreters. Oh, so that was really nice. I think now looking at it from the diversity from like the faculty, staff, and maybe like residents and fellows, we definitely have Black people represented. Can I say that it's at the level where I want it to be? No. Okay. I think it's important to me to have our patients see physicians and medical personnel that look like them. Yes. So this is why anytime somebody comes to me in terms of like, oh, I'm an undergrad student interested in medicine, I'm like, oh, I'd love to talk. I want to bring more people into the fold of medicine because I think it's so important for, again, patients to see doctors that look like them. Yes. I think it is such a profound interaction when, I have a little 4-year-old Black girl that's like, wait, you're a doctor? Oh, like I can do this? Or, families are smiling at the end of the visit. They're like, I'm so glad I found somebody that looks like us. Things like that. And, I've even encountered like Haitian patients. And I'm like, oh, I can speak to you in Creole. And like, that is such a special moment because they're like, this is the last thing that we expected to find here. Yeah. So I think that has been such a pleasure to be able to kind of be a face like that for the patients that we interact. But it also, in some ways, almost places a burden on us to be better than anybody else because there are more eyes sometimes our way. Yeah. Just to kind of give you the breakdown, and within the PEDS department, amongst us third-year fellows or third-year residents, I'm speaking things into existence already. Hey, but it's coming into existence. Exactly. That's what's important. So there are 2 of us that are Black in my year. So, and we're both females. In the second year, there are another 2 that are Black. And then amongst our first years, there are none. Okay. And in the incoming first year class, there are none. So it was interesting because I felt as though we kind of had this momentum a little bit maybe, and then now and maybe in the era of like virtual recruitment and stuff, we haven't been doing our job in terms of attracting a more diverse group. So I think that's been a little bit more difficult because those are definitely people I would want to see represented. I think in the era of Black Lives Matter and so many different things that are happening across the U.S. in particular, cultural sensitivity and diversity training, those kind of conversations are coming to the forefront. Good. So we've definitely had a lot of kind of like seminars or lectures or just topics or focus groups or things that have been happening, I would say, within the last year and a half. Yeah. So I think it's definitely something that people are talking about more and more conscious of. And I'd rather it, happen now than later or never happen. So I do appreciate that. But I'm hoping that we'll start seeing the benefits of that a little bit more soon. There are definitely microaggressions that I've experienced, and I probably would experience them anywhere I go, to be completely honest. But, I can only speak to my, experience here. Whether, getting called by the other Black girl's name or, things like that. And I've learned how to pivot and adjust in those moments and still be professional, but also let them know, like, this is not acceptable. Not okay. We are completely two different people, and you didn't confuse the blondes. So let's get this straight. So, I mean, we definitely have had that. In fact, I had that happen last week with somebody who knew me relatively well, so it really wasn't a good excuse. Yeah. But definitely those kinds of things happen. So I think really just being kind of a voice, even though you don't want to just all the burden is on you, because also people have to educate themselves, let's be completely honest. Yeah. But I think being conscious of some of the microaggressions, even, calling them out for what they are, and then really just making a push to do better. And I think there are lots of like-minded people that I've experienced. I think our Office of Cultural Diversity is really great. Okay, that's good. And have excellent leaders. And I would say I've also gotten to know a lot of kind of our more melanated friends across the different specialties within the hospital. Yeah. I have friends in ENT. I have friends in surgery who are, like African or Black American or, like all these different things, but they are still a source of support and kinship for me, even though we don't necessarily always have the same experience because of our subspecialties, but you have that support where there's somebody that's going through a similar experience as me. And I will say some of those departments actually did a lot better with their recruitment of minorities. That's good. So, I can't remember if it's urology or anesthesia, but one of them, they literally had like 4 Black females that were recruited and matched there. Like, really, awesome. And their department is smaller than ours. So that says a lot. They're clearly doing something that we maybe need to take notes from. But, I don't know. I got asked along the interview trail for fellowship, would I rather be in a place where cultural, diversity is already represented amongst the staff and it's just easy to slide in? Or do I want to be a trailblazer and kind of bring that there? That was a hard and interesting question. And I think as much as I like the comfort, I went to an HBCU for college, so I like the comfort of having, people that maybe have similar experiences or backgrounds, but I think it's also important to pave the way a little bit. So, I don't remember exactly how I answered. I feel like I was a little bit in the middle, but definitely leaning more to kind of that trailblazer. So
I see it. I see the trailblazer.
Thank you. I'm trying, but
what undergrad did you go to?
So I went to Oakwood University in Huntsville, Alabama. Whoop whoop. Oh, you.
So many Oakwood.
Yeah, we have a.
And then you went to Loma Linda, so I was like.
Yes, you saw the trajectory.
I saw the connection.
But yeah, indeed. But yeah.
I went to North Carolina A&T.
Oh, so you understand.
Oh, of course.
Yeah.
Always.
How do you feel like that's shaped your experience, even like throughout med school or kind of your life thus far?
I guess going back a little bit, right? Being here in Nashville and then being African, it wasn't really like my parents forced me to be with one group of people at all times. Yeah. I was very much around every color under the rainbow. And so for me growing up, it was never about, I need to connect with my African American community because I already had my African community. Yeah. It wasn't until I moved from here to North Carolina where I was placed in a place where it was mostly Black folk, Latinos, and Cambodian, Laotian, Thai, Vietnamese.
Okay.
It's a really interesting area of Greensboro, North Carolina, specifically. And then my dad, he worked at TSU, and then he worked at North Carolina A&T. So I knew about HBCUs, but, you know, the news never talks great about HBCUs, especially during that time. They're always talking about, like, oh, this pizza guy got robbed at TSU and blah, 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 which is not the case. Like, TSU was a good school, but they always want to bring up the negative.
Yeah.
So that's what I always had in my mind.
Gotcha.
And going to school with kids who were aspiring to go to Harvard and Yale and my dad going to UT Knoxville, and I'm like, I love the Vols, so I want to go to UT Knoxville. I never in my mind was thinking, oh, I'm going to go to an HBCU. Yeah. And then when I got into the space where I'm in a all black, except for one flutist who was white, marching band, and like, I'm really immersed for the first time in African American culture, and really kind of seeing like, yo, this is the culture and the opportunity and the avenue that I need to be going into. I don't want to just be somebody who's thinking of, oh, well, if you're from this part of the city or this area, it's ghetto. It's blah, 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 blah. And looking down upon that. Because at the end of the day, we're all the same skin color. We're all fighting for the same things and trying to enrich our community and make it better. Yeah. And so that's when I kind of like a lot of pivoting my mindset in high school to wanting to go into a space where I feel accepted. Yeah. So I felt like going to an HBCU, I applied to UT Knoxville. And the only school in North Carolina I applied to was North Carolina A&T. I did not want to go to Chapel Hill. I did not want to go to Duke. I didn't want to go to ECU. I was just like, if I'm going to stay here in state, I'm going to A&T. Yeah, I'm going to A&T. The best HBCU in North Carolina. Quote me on that. Oop. Just want to say.
Shots fired. Pew, pew, pew,
a lot of them. Gotcha. But like, and that's where I felt myself really grow and mature, and not only understanding myself as a man, but as a black man, as a first generation African American man, as a black man trying to get into medicine from a school who isn't big in medicine.
Layers upon layers.
In a school that most people have to take time off. All of that, and finding success. Yeah. Also some failures because I didn't get in right away. Yeah. And having to take some time off. But then eventually getting here to Meharry because I knew that, even at that point, I was like, I'm either going to be going to Meharry or I'm going to be going to one of the North Carolina medical schools because they do a great job. ECU and Chapel Hill do a fantastic job of actually recruiting and getting black students in medicine. Gotcha. Like their SNMAs are huge with a lot of African American support. So I knew like if I was going to those schools, I'd be fine. And then I wanted to go to NYU because I mean, heck, at that point, I had done a summer program. I loved New York. But then also the whole, free tuition thing. Like, who wouldn't want to go there for free tuition, right? So I was like, like, those are my schools. But Meharry was it. Because I was like, I know that, some of the most African-American doctors in this country, MD, DDS, PhD, a lot of them came from Meharry. Gotcha. And so I knew like coming to Meharry was going to be, was right for me because I still want to be in a place that I feel accepted, I feel welcomed. I've talked to some of my friends who've been in PWIs for medical schools. And, they feel that kinship between those of them who are there, but it's still people looking at you like, oh, you got here because you're the token, or you got here, or, we have our little, clique and we might invite you to a few things, but not really, or people can be very standoffish. Well, at Meharry, in a lot of ways, we try, at least in our class, we try to be supportive, we try to be helpful to each other. And there isn't any kind of like superiority feeling amongst, like superiority feeling in terms of if you're smart, but not because you also already feel like you're superior in just medicine as a whole. And so that's why I feel as though choosing HBCUs for undergraduate and for my medical education has been very important in just my growth as a man. And that's why it's also important for me to go to a place that also respects that. They respect the fact that I'm coming in with a completely different perspective. I am coming in as a black man who wants to work in my community. That's why I want to work with sickle cell patients, because why is it one of the oldest diseases ever to be known, but yet has less funding and research than cystic fibrosis and things along those lines? So I want to be able to be a game changer in that space. And first, understanding myself was important to do. And I'm thankful that I've been able to do that.
Yeah, I think that's good. And just, I know we're probably running out of time, but one thing that I think is important when you're kind of going along that interview trail for residency, don't be afraid to ask the hard questions. Okay. Whether it's to faculty, administration, and then of course the residents there. Do not be afraid to ask about what diversity looks like, what initiatives they're taking, how are they impacting their community. I think all of that is very important because there are different things that you can do, whether they already have some established programs or some people that are interested in some of that, or, there are advocacy opportunities, there are, global health opportunities. There are so many different ways to kind of tackle and be involved in your community, and especially kind of impact the lives of people that look like you in that surrounding neighborhood. So if there are programs that, you kind of say that and they're like, cool, or good for you, that sounds admirable, run away.
Gotcha.
There are programs that will support you and help fund you and, help you make those impacts and maybe even start long-lasting programs that will be carried by, future residents that, come up behind you. Yeah. So make sure you ask some of those hard questions. Don't be afraid. If they're not interested, then that's not the place for you.
All right. Blank. Appreciate that.
Well, guys, that's our conversation. Thank you so much for tuning in.
Follow, like, and subscribe. And catch you guys later.
Yep.